The Ministry of Health has continuously been put to task to account for all the funds they have been allocated to fight the COVID-19 pandemic.
And accountability for...
However, accountability documents Minister Ruth Aceng presented before the Parliamentary COVID-19 Task Force show that only 775 billion shillings was allocated to the ministry between March 2020 and June 2021. The funds include 372.7 billion in government releases, 389.1 billion through external support, and 12.8 billion in kind donations. Minister Aceng says most of these funds have been spent on personal protective equipment, testing, salaries and allowances of health workers, among others.
2 is negative propaganda, fake news, misinformation, leading to a demotivated workforce. Insults to the health workers is causing us a big problem because they will eventually start abandoning patients.
Mr. Chairman, I've just looked at one document, summary of distribution of donated items towards the COVID, and they are showing districts, 20 districts got these cars. These ones got 15, but we must note the names of the particular districts and the number plates of those vehicles.
We will have another meeting with the ministry officials where you can raise those documents after you've studied them. As of now, I don't think we'll have time to even interrogate those documents.
From giving accountability of the spent funds, Minister Aceng revealed how the ministry requires 1.7 trillion shillings to manage the second wave of COVID-19 in the next 12 months. The ministry has only received 461 billion. Of these funds, 141 billion will be for continuity of essential services, 445 billion for COVID-19 vaccination costs, 808 billion for logistics, strategic information 70 billion, risk communication 68 billion, case management 93 billion, laboratory 85 billion, among other expenses. Minister Aceng also gave assurance that 12,274,880 doses of COVID-19 vaccine will soon be coming into the country through the COVAX facility.
We give ourselves a target as a country and procure this vaccine. Put everything at halt. This money that is going to disappear, it disappeared in masks, it is going to disappear in food. Why can't we put everything aside and we get significant numbers of vaccine?
Chair, there is a window for procurement from third parties, direct procurement from third parties to the manufacturers. These windows are extremely expensive. We can procure the Sputnik vaccine from Russia through a third party at $29 per dose.
Uganda has only spent 41 billion shillings in procuring vaccines, the rest being donations. Herbert Ziwa, NTV at Parliament.